What is bone biopsy? This is Dr. Abhijit Ashok Salunke, orthopedic oncosurgeon from the Gujarat Cancer and Research Institute, Ahmedabad. If a patient presents to a doctor, he examines the patient. And what are the steps of bone biopsy? It's a test in which small tissue is removed and that specimen is sent to the pathologist. The first key step is use of anesthesia. That can be local or general anesthesia, which is used. A bone biopsy needle is inserted into the bone and small tissue is sent to the pathologist. The pathologist examines this tissue and tells that it's benign or malignant depending on the characteristic of the tissue that is received. These slides are examined by the pathologist, and the average time taken to get these reports is around 5 to 7 days. If few special tests are required, like immunohistochemistry markers, it will take a bit more time. A kid presents to a doctor with pain and swelling around knee or hip joint. Doctor clinically examines this patient, advises for specific tests, and asks for the symptoms and do proper clinical examination for this patient. After this, blood tests are performed, which is followed by the radiological examination of the affected limb is performed by the treating doctor, and a chest radiograph is performed. This is followed by a magnetic resonance imaging of that affected part. So the doctor sees where the tumor is based on the radiological imaging and all these tests. So next important step is for the patient is magnetic resonance imaging of the affected part. This is followed by the bone biopsy, what we have seen in our previous slides. So we'll show you what are the key steps of bone biopsy based on use of virtual reality. So this is a simple software which is developed, and we can see what are the steps of bone biopsy. So first key important step is painting and draping. So here, in this case, the tumor is affecting the foot area. Local anesthesia is administered to the patient, which is followed by use of a small incision. A knife is used. A needle is inserted into the affected tissue. The material is aspirated and which is collected into this kidney tray and sent to the pathologist. Single suture is taken and dressing is applied. So these are the key steps. What we have seen, what is bone biopsy, what are the common clinical examination, what tests are performed before the bone biopsy, and a virtual reality surgery, what is for bone biopsy. Next, we will see use of intelligent bone biopsy device. So what is this intelligent bone biopsy device? The needle is having specific sensors, which are depth, distance, and pressure sensors. You can calibrate it according to the disease of the bone, and the tumor will stop, the gun will stop automatically at the opposite cortex. Lastly, we'll see a video of a patient for which bone biopsy was performed. First step is marking the skin incision. So in this case, it was a medial skin incision that was marked. This is the final biopsy scar, which will be excised by the treating surgeon. First step is giving local anesthesia. This is followed by insertion of the Jamshedi needle. Take few good cores. This is how the first step is giving local anesthesia. A stab incision is given. The surgeon takes the Jamshedi needle in his hand. Screwing and rotating movement is performed. He will try to aspirate if any material is coming out from this needle. Around 3 to 4 good cores are taken. Again, the surgeon is inserting the needle inside the affected bone, and good 3 to 4 cores are obtained. These will be sent to the pathologist, and the pathologist will examine all the material. So this is how the material is collected and sent to the pathologist. Single suture is taken. So thank you very much for your patient listening.